Hi, Maria here. Today I'm going to be showing you some anatomy and physiology and techniques to release the deep hip rotators and the 3 glutes. And I would like to start with my client supine and show you a couple of tests, actually 3, to show you if it is sciatica, because I know all my clients that have low back pain right away they say it's sciatica and they self-diagnose. So what I would like to make sure that you stay within your scope of practice and remember that this is not for diagnosis. We do not diagnose, but it is very helpful for us to know the difference, whether we can help our clients or we need to refer out. So while she's in the supine position, the first thing we want to do is do the tests. I have the client holding the sheet right here, and don't feel, bad if you ask your client to hold the sheet so that she can keep control of the tightness so nothing is exposed. When we're working the deep hip rotators and the glutes, it's very important to ask your client to disrobe completely, because then you can really get in very specific work. So this is why she keeps control of the sheet so nothing is exposed at any time. This is the straight leg test. You lift the leg about 30 degrees and make sure you ask your client, look at their eyes, have eye contact with them, because their facial expressions can tell you if they're feeling any pain. They might not tell you right away, but you'll see them flinch. If I go higher and she flinches, then then she'll tell me, yes, she has pain. So you can go up 30 degrees all the way up to 90 degrees. And if she does have pain, the sciatic nerve is being stretched at this position. So if it is sciatica, she would feel pain. At this point, it's a positive test. So then you would want to do the Bragger's test, which you would dorsiflex the foot several times, 2 or 3 times, not several times, 2 or 3 times, to see if that also causes pain. So then at that point, if it's a yes, then you bring down the leg. You always assist. And that would tell you that that is more than likely coming from the lumbar area. There might be something going on there. The third test is for the Piriformis syndrome. You bend the knee and you bring the leg over to the height of the opposite knee, bring it over this way, and push her leg over, stretching the piriformis muscle. And this will let you know if it's the piriformis muscle or the lumbar area that's causing sciatic nerve pain or other. I'll show you also when she's prone, I'll show you other things that it could be. So at this point, if it's hurting here and pulling here, more than likely then it's the piriformis. If it's the Bragger's test, the straight leg test, then it's probably the lumbar area. You assist the leg always, you don't let it flop. And at this point, you would have her let the sheet go. And also another thing, if your client does have low back pain, when they are in the supine position, you always want to put a bolster, because that takes the pressure off the low back. I use the Lacuna Botanical Deep Tissue Massage Cream. It has 200 milligrams of CBD oil. It is topical, not edible, and I use it specifically for people that have pain. And it smells very good. It's got very good natural ingredients. If you're interested in this product, I sell it on my website, and you can look at the link below. And you use a dime size. It comes already pre-measured, and it's very good. It glides very good. So I want to show you some techniques from this position while she is supine. I am warming up a little bit the TFL and the IT band. And from here, you can actually get the glutes. And what I'm doing is I'm cupping my fingers a little bit and going medially right on the lateral border of the sacrum and pulling out, because this way I am also massaging the piriformis, the gemellus, the obturators, all the way down. Okay, and this is her gluteus maximus that we drew yesterday on there. And what I'm gonna do is go with 8 figure 8s right here along the trochanter here, and show you real slowly, because all of the deep hip rotators insert right here on the trochanter like a hubcap, like that. There's 6 of them, so they're all right here and insert right here. So you want to make sure and get all of the insertions in the IT band, because the IT band is really tight on a lot of people. So from this angle, this is all you would want to do. Just some effleurage, petrissage. This is petrissage here. Some figure 8s with the knuckles get in there really close. You can feel her trochanter right there. And you can get the muscles from this angle. So now we're on the sideline position, and you always want to make sure that you're supporting the cervicals, that they're straight from C1 to C7 and from T1 to T12 and from L1 to L5, that it's a straight line. You put pillow between their knees, the bottom leg is straight and the top leg goes over bent. In this side view right here, you can see it really shows the glutes, and we drew them for you. We cut out part of the gluteus maximus because the gluteus maximus is still covering right here, but we cut it out a little bit so that you could see the gluteus medius. This is where you get a shot. When you go to the doctor and you get a shot, it's always in the gluteus medius. And the gluteus minimus, it's right here underneath also the gluteus medius. So you can kind of see the gluteus maximus, the origin at the sacrum, at the ilium, insertions at the greater trochanter, and also the gluteus medius at the iliac, the origin, insertion at the greater trochanter, and the gluteus minimus. You have 9 muscles on each side. Okay, you have your 3 glutes, and underneath the 3 glutes are the 6 deep rotators. So you have your gluteus maximus, medius, minimus. You have underneath that, you have the piriformis, gemellus superior, gemellus inferior, obturator externus, obturator internus, and the quadratus femoris. All of those are underneath here, and they're drawn on the other side. You will get to see those too. From the sideline position, you can do figure 8s. You can do skin rolling to warm up the muscle. You always want to make sure and tuck in right here at the hip, at the waist, so that nothing's exposed, and she holds the sheet with her arm. Okay, you can make sure that just expose this area. You can turn them on either side that's hurting, and you can do some petrissage, some effleurage, and this really exposes the muscles. Really good for you to be able to reach the insertions. Like right here at the trochanter, remember the trochanter where the femur, the cerebellum goes into the hip joint? It's all right here, and this you can really get the trochanter, all the insertions of the muscles and the trochanter. Remember the six muscles of the deep hip rotators are right here like a hubcap. So they all come from the glute, underneath the glutes, and insert right there around the trochanter. So you want to make sure and go like underneath, feel the bone, and get all those insertions. This really relieves a lot of tension and a lot of pressure. So this is a really good position for you to get each muscle underneath the superior and the inferior muscles, and also the superficial and the deep muscles. So remember that muscles come in layers. So the glutes are more superficial to the deep hip rotators. So right here you have your sacrum. It's a triangular shaped bone. Okay, so all the muscles originate right here. Remember, their origins are usually medial to the body, and the insertions are more distal. So from this place right here, you can really get all the origin of the gluteus medius, maximus. Right here, you can do 1-inch strips. You can do figure 8s. You really want to be able to address all the muscles right in this area right here. And this is a little bit deeper, and you address muscles that maybe you wouldn't be able that we weren't able to get from the supine position. And you can also, from this side, you can also work the IT band. You know, you go to the opposite side and work the IT band, and just work all of this area right here where all of the muscles insert. I sometimes use over the sheet, and that's fine. I can massage over the sheet, and that's fine too. I want to talk a little bit about the difference between entrapment and compression. Entrapment is when it's muscular. Compression is when it's osseous, meaning coming from the bone. We can help our clients when it's entrapment. That means that the muscles are tightening on the nerve. And when it's compression, it has to do from the lumbosacral. The sciatic nerve has 5 roots. They come from L4, 5, S1, 2, and 3. They join and make up the sciatic nerve, which is as thick as your thumb, and it goes underneath the piriformis, down the leg, and all the way down to the heel and to the foot. When your client comes in with pain, you know it's severe if it's already traveling down the thigh and the calf. If it's just right here, you need to do some investigating, because a lot of times it's not the sciatic nerve. A lot of times it could be the gluteus minimus, which mimics sciatic nerve pain. It could be the biceps femoris. When the hamstrings are tight and the biceps femoris is pulling, it can cause low back pain. It could come from the tuberous ligament, the sacroiliac ligament. It could be from the minimus or the piriformis. We can help a client if it is the soft tissue, meaning entrapment. If it's osseous tissue, that's where the doctor comes in and they diagnose that, usually with an MRI. It can be from a slipped disc, from a herniated disc, from stenosis, that's the narrowing of the bone, of the foramen in the bone. And for us, we're going to stick with the soft tissue. So what you can do is work the piriformis, which is shown right here, and you can only have this side exposed. You tuck in at both sides. You don't want to tuck in at this level. You want to tuck in at the leg and around the waist here. Tuck in the sheet really good. All 6 muscles insert right here. You can start superiorly and work yourself inferiorly right around the trochanter. And the gluteus maximus inserts right here at the gluteal tuberosity of the femur, and also the iliotibial band. So you want to do figure 8s. You want to start at the origins right here, at the sacrum. Remember, the sacrum is like a triangular shaped bone right here. So you want to feel the edge of the sacrum. You feel the bone and then it dips down a little bit. That's where almost all the origins. The origin of the piriformis is on the anterior part of the sacrum, and it inserts at the greater trochanter. This is the obturator internus. The obturator externus originates at the pubis. This is the quadratus femoris, the gemellus superior, gemellus inferior, which I really faded, I'm sorry. And then we took away the glutes. Remember, the glutes were on the other side. But you want to make sure and start at the origins. And you have all the origins of the gluteus maximus, the piriformis, the obturator is at the ischium. The ischium bone is the one that you sit on. The gluteus maximus moves out of the way so that you sit on the ischium bone. The pelvic girdle is made up of the 3 bones, the ilium, the ischium, and the pubis. These are very tender because most people don't get these muscles worked on. So don't apply too much pressure. Remember, it's more about being specific and staying within the pain tolerance of your client. I usually use a scale of 1 to 10. 10 being the most pain they can tolerate, 0 being no pain, and I ask them, you know, what feels comfortable, and I try to keep it between a 5 and a 6. You can tuck the sheet in right here with your knuckles, and I just do, with my knuckles, I go over the trochanter again. For bulkier people, you can use your forearm. You always want to push in. If you're going to use your forearm, you always want to push in. You never want to pull out. You never want to separate the cheeks. You always want to push in and hold the sheet on this side too, if they've disrobed. Or you can also work over the sheet. The origin of the biceps femoris is right at the gluteal fold. A lot of times that is tight and it pulls, and it may cause low back pain, when in reality is the biceps femoris that is tight. So you can massage over the sheet. You can make sure and go to the gluteal fold, to the origin of the biceps femoris, and check that out. Make sure that that's not what's causing the low back pain. So you have several things that you need to investigate to make sure that you know what is causing the low back pain. It could be the tuberous ligament. It could be the SI joint. It could be the piriformis. It could be the gluteus minimus. Gluteus minimus also mimics sciatic nerve pain. You have a lot of clients that right here at the insertion, it's a little bit above the trochanter right here where it inserts right there, and a lot of people feel pain, and that mimics sciatic nerve pain, and it's not sciatica. It is the gluteus minimus. So you want to make sure and do some investigation before you tell your client, oh, you have sciatica. Sciatica is a symptom. It's not what causes it. Sciatica is a symptom. Just like your headaches are a symptom of something more, like if you have high blood pressure, then you get a headache. Well, sciatica is the symptom. It's not the cause. Sciatica is the symptom of the sciatic nerve being inflamed when the sciatic nerve is being pinched, pressed by the piriformis. So you want to make sure and address all the muscles here to figure out and to help the client to figure out what, brings relief. Another way to get to stretching this, you bend the knee, the leg at a 90-degree angle, and make sure that the leg is not way out here because you could dislocate something here. You want to make sure that the leg is tucked in, okay? I've seen this done before where the leg is really out, and no, the leg has to be in. You can place your hand right here, and you can feel the muscles move. Like if you want to go right on the piriformis, you can. And all you're doing is you're putting pressure, and you're rotating the leg in and out. And you can feel the muscle moving. And you can start superiorly, 1-inch strips, do it a couple of times, and move down. And you can really feel where the muscles move, and you can feel the tension in the muscles below your fingers. And for somebody that's a little larger, I would use probably my knuckles to try to make sure that I keep the hips stable. Yeah, this is a little bit easier for me to use my knuckles than my fingers. After 30 years of practice, I can't use my fingers too much anymore. But this is really to go around the trochanter and put a little bit of extra pressure. And remember, you've got to stay within the pressure of the tolerance of the client. I use the scale from 1 to 10. 10 be the most pain they can tolerate, 0 being no pain, and I usually ask them to stay within a 5 or a 6 that's more comfortable. This type of work is not about how much pain they can tolerate. This type of work is about being very specific. That's what this type of massage does, is very specific, targeting each muscle individually. And that way you can really get to what the problem is. So this is another position that you can really get to the trochanter right here. I've put her knee up, and I call this like the frog style because it really opens up the hip right here. All of these insertions right here again that you can get to. And massage right here. You can also work the TFL. The insertion of the gluteus maximus. You can use your forearm for bulkier and bigger people, and just, don't put too much pressure where it's hurting the client, but you can gauge and keep an eye on them or asking them if it's okay to do this. You can go a little deeper here. It kind of relaxes the muscles here a little bit. It kind of flexes the muscles here so they're not pulled tight. And that's why I like this position right here. You can also cover the glute completely if that feels the client more comfortable. I'm just showing you so that you could see, since we drew the muscle, so you could see what it looks like. But you can cover the client. You can do circles here. You can really feel the sacrum, the edge of the sacrum here, and the ischium. So this position is really good to really get a little more detail and a little bit deeper and more specific. She doesn't have low back pain. And people that have low back pain, they really appreciate you doing this work. You always want to assist your client when you put the leg back. Support the leg. And remember that if your client has low back pain, you want to have a bolster underneath their legs. And when they're in the supine position, underneath the knees. So in conclusion, what I really want you guys to understand the difference between entrapment and compression. Remember, entrapment, we can help our clients because that has to do with the soft tissues, the piriformis and all the glutes and deep hip rotators. Compression comes from osseous tissue, and that's a diagnosis from a medical doctor. That's beyond our scope of practice. So we are investigating when we work on somebody. We want to make sure that we figure out whether it's the biceps femoris or the gluteus minimus or the piriformis, or it could be even the QL. So make sure that you do your investigation and that you really treat the whole area. When in doubt, treat the whole area and you'll be able to help your client. And if you like our video, please give us a like, subscribe to my channel, and stay tuned for our next video. Follow me on Instagram and check out my website, especially if you want to check out the deep tissue massage cream with 200 milligrams of CBD oil. See you next time.